Hello.
Yes, Bernard, thanks.
Yes, I'm here with you again. It's very interesting to make the analysis of the patient. So the camera is on the right side. You see, the patient has a lot. Please, I want to see for face, frontal view. So the patient face is very interesting because she has a lot of asymmetry, and that happens very often. So you have to clarify this point with your patient. There is an over height eyebrow on the left side, and then the impression to have a lower eyebrow on the right side. So the recruitment of the skin is much important here than here. To balance that, you should use botulinum toxin here to elevate the tail of the eyebrow, and just 1 point of botulinum toxin here to lower a little bit of eyebrow. Symmetry is not essential, but it's a sign of relaxing, nothing else. Then the other important thing is to see the contour of the lady. There is an excess of fat under the chin that would need the treatment through liposuction under local anesthesia. It's a 25 minutes technique, not important, but very.
Do we have some alternative to liposuction?
Well, I think I was the first to use phosphatidylcholine in France about 8 years ago, but all these treatments were forbidden by the French laws, so I'm not able to provide that more.
But in other countries?
Yes.
We can use?
I think so.
Slim?
Yes.
For sure?
It works. I personally prefer to use liposuction because I know what I'm doing, and I know where exactly is the fat in excess, and I can keep some of the fat to be injected elsewhere from the same patient. So you can save some filler with the own fat of the patient.
The best things are forbidden in France, yes? HLAs, mesoline slim, what else?
I don't know what else, but all the treatments that were supposed to vanish the fat were forbidden, even either injections or physical treatments, for no evident reason. So the contour is interesting here. You have the bulging, the famous middle bulging, then the depression here, and you see when I draw, the depressions are different from one side to the other one. You have to take account of this. And then the gonion is disappearing. So we can give the illusion of a better contour just by injecting this area and this area. If we want to avoid any botulinum toxin treatment, we can elevate the eyebrow here by injection of Pluryal here. Here I will use Pluryal volume, here the basic Pluryal, just to have the.
Can you explain very carefully where exactly you will inject in the area of eyebrow? I mean, what is the depth anatomically, where under or on the top of the eyebrow rim?
The bone is just here, so if you want to be efficient, you have to inject exactly where is the bone, and you have to be deep. So here, if I can, I will use cannula, because as told us Thomas this morning, there are a lot of reasons to have bleeding and ecchymosis in this area. So I will go deep and just with the tip of my cannula know where I am and just inject deep.
And what is the dangerous during those injections? Some vessels, nerves?
I think there is no any danger out of ecchymosis and bruising in this area. I think that during the discussion we will speak about dangerous zone. I have seen recently a very intriguing complication that I will tell you later because of an injection in this area. But now let's concentrate on the patient.
Thank you.
And the next treatment will be the mesoline treatment. She has a good skin complexion, but I promised to show you how to do. I will inject through 2 separate points superficially to have some superficial skin improvement, even if this patient is not the ideal case, because she has a very, very good skin tone, but I will use it right now. Thank you. Close. Thank you. Oops. So I made just a little anesthesia at the entry point of the cannula to have more comfort for the patient. I think comfort of the patient is really essential. When you can avoid any pain, it's much better. So can I have the cannula? Yes?
What is the size of cannulas that you will use?
Yes, I was going to tell you about the size. I can use 27 gauge cannula, but I must confess that I prefer to use a 25 one. The only reason it's more stiff. I think the 27 is very flexible. I'm not sure exactly where is the tip of the cannula. And in my opinion, there is no really any difference of comfort between the 27 and 25 gauge cannula. So normally, while I'm speaking to the patient, can you turn? Yes. I just start to put my needle here. Then I try to have 30 seconds or a minute to speak with the patient.
Have you made some local anesthesia in the place where you start? Yes.
Yes. I made local anesthesia.
Thank you.
So here we have the opening of the cannula. You see that it's not viscous. It's very easy to inject through this type of cannula. And sorry, keep it. So the entry point is not always evident. Everybody knows that. Give me the needle once again. I like to use a 21 gauge needle because the entrance of the needle is much easier. But here we are. So when I am here, I go under the dermis as superficially as possible. I will never be intradermal, of course, because with the cannula, it's something very, very difficult. But with the 25 gauge cannula, I know exactly where is the tip. And so, with withdrawing movements, I can spread my combination elixir in different places of the cheeks.
And what are you injecting?
Sorry?
What are you injecting? Which filler?
It's the mesotite plus Pluryal, basic Pluryal, so reticulated hyaluronic acid, because this is a mature skin. I consider it as a mature skin. And if necessary, I can go up to the lip from this point of access. It's very easy. She doesn't need really to have any correction here, but I can do that if necessary. So I control with my left hand fingers where I am, where is the tip, and I gently withdraw my syringe on a different aspect of the area to be treated.
So finally you are in the superficial fat pads, yes?
Yes. If the skin was in very bad condition, I would use the technique of with a needle. And something I've recently developed is I transfer the mixed product in a insulin syringe, and that helps to be very, very superficial. And you can inject even very thick hyaluronic acid in a very superficial way. So there we are. Now we're going to treat the inferior aspect of the face. I need the needle and the next. No. Just the needle. And this, yes. So from here, this is the same mixing of MD Skin Solutions products.
In the same composition, yes?
Yes, the same one.
And what is the total volume that you have been injected into the chin, into the cheek?
1 cc.
1 cc per cheek, yes.
Normally, I share the mixing solution between 2 to 3 area. So it could be between 1 and 2 cc, depending on the skin condition
Okay,
and
thank
the
you.
requirements. Thank you. So here, I will make spreading injections from the oral commissure, withdrawing the cannula. And you see there is no sign of discomfort for the patient. The patient is very nice, I must confess, but anyway, you see that we can really be have a spreading effect. If the skin is on very bad condition, I repeat, it's better to make dermal injections, because here you have the best tissular induction. But when you have 3 to 4 sessions in the same area, you will have the same, in my mind, the same effects that injecting once or twice in the very superficial aspect of the skin. Here we are. And now I will turn to plurial volume to restore. Give me, yes, needle and then cannula. So we can mix bolus injections. We are very efficient to elevate. So I am against the bone here, and I inject 0.2 cc. 1, 2, and 3. It's the same here for the gonion resuscitation. It's important to be right to the bone. Here I am against the bone and make a bolus injection to elevate this area. So as I told you this morning, it's just illusion, of course, of the oval restoration. Just illusion, but it works. Here we have injected 0.6 cc. I will turn to the cannula. Normally my approach is from here, but for a better view, I take a lateral approach. Just give me some thing. At this time of correction, my advice is to borrow all what you have designed before, because it can trouble you for a definitive correction. When you take off the drawings, you see what is missing. You know, it's missing. There is something missing here, and the inferior border of the mandible is quite well restored, but just missing a little bit superficial to have a very good and efficient correction. So here I am, very superficial. This is the tip of the cannula. I maintain the skin, and I try to be as low as possible. Okay, this is the first point. Then I will have to turn to the lateral aspect. So give me the needle, please. Thank you. And I will finish to fill this little hollow which is here. Until now, we have just used 1 cc of volume, Pluryal volume, to make the correction. I will add something here because there is a little hollow. Give me some more volume. Thank you very much. And with spreading technique, quite superficial. You see the tip of the cannula, which is here, because superficial injections are more efficient than deep ones, where the skin is not very thick. I finish the correction.
Bernard,
yes.
You have changed the syringe. What are you injecting now? The same volume or it's elixir?
It's volume.
Ah, so it was and it is now also volume, yes?
Yes, like before. It's the same solution.
So we hear questions. Maybe it's just visible, but it looks like you are injecting subskin, not supraperiosteal. Are you injecting subskin or supraperiosteal?
No, subskin. Subskin. Yes, the supraperiosteal is with needle.
Mm-hmm.
I am not able myself to make a supraperiosteal injection with a cannula. And then I will turn to Pluryal, basic Pluryal. This is the volume we keep. Thank you. And give me a needle. Yes. We are going to finish with the elevation of the eyebrow, lateral elevation of the eyebrow. Thank you. So here I try to be deep. I am against the bone here. You don't see the tip of the cannula. But here it is. That's why I like the 25 cannula, because it's stiff enough to know exactly where it is. With the 27, sometimes it's binding and you lose the tip. And then I withdraw. Give me something to swipe. As I told you, it's important to take off the drawings you made to have the exact correction you're looking for. Can you be here? We can reinforce the elevation of the tail of the eyebrow. Here. Okay. Here I injected 0.5 cc. If necessary, we can make a little massage, but I don't believe I told you very much in massage. Just for the superficial aspect of the skin. For instance, here, I used to take an ointment at the end of the procedure when I do the meso injections and gently spread in everywhere I can what I did before. I have no ointment here, but the patient appreciates that very, very much. The same here, the same you can do in the contour. Can you find your date? You can sit. Excuse me. Just look at the camera. And we can appreciate here the gentle contour was provided with the apparent gonion, the angle of the mandible, which gives the illusion to have a longer mandible, so a longer recurving face here. What you would need also is maybe just a little addition here, because there is an asymmetry, so this is easy to do with whatever you want, with volume, of course, and deep injection. And we see that we have symmetry now of the eyebrow, almost perfect symmetry without the use of botulinum toxin. Any question? apparently no question. Thank you very much. And thank you to the patient.